And you are live now.
Good morning, everyone. Welcome to the second lecture of the Research Methodology series of WOS and DST collaboration. We have with us a very talented Dr. Pooja Khamar today as a speaker. The topic of our lecture today is how to write a good research question and a protocol. Dr. Pooja Khamar is currently practicing as a consultant in phaco and refractive surgeries at very prestigious Narayan Nethralaya, Bangalore. She is very well known for her role in research in refractive surgeries, dry eye, and keratoconus. Over to Dr. Pooja.
Thank you, Dr. Nisha. I would like to thank Mohita ma'am, the entire WOS and the Winr team for having me here and allowing me to give this short lecture on how to write a good research question and a protocol. It's a very important topic because whenever you are trying to do research, whenever you're trying to publish papers, or trying to do something new, everything starts with how to write a good research question and protocol. I did hear that last week you had given a small talk on literature search in PubMed. It was quite well received and you had done a very good job, so I'll also try to do justice for the same, because once you have done your thorough literature, like even if you want to do literature search, it all starts from why you want to do it and what you're trying to answer. So the basic lies in how to write a good research question, and then everything else starts. So without further delay, I'll just try to share my screen. I wanted to tell you that it's you've given me 45 minutes. I don't want to become monotonous. So if you want to take questions in between, we can always stop and answer questions. So we finish it phase wise, and we don't keep it anything at the end. So whenever you're trying to address a research question or protocol, why you're doing that? Because everything today is about evidence-based medicine. And evidence-based medicine is nothing but it's an effective balancing of data, professional input, and patient preferences. It does allow physicians to stay updated on the new research and technology, enables physicians to make personalized decisions based on the global evidence. It creates greater transparency and accountability of what you're trying to address, and it improves the quality of care and outcomes. So what is evidence-based medicine? It is nothing but making use of the best available information to answer the questions in clinical practice. There are various arms to it, but it all starts, there's an arm of best research evidence, clinical expertise, and patient values. But today, as today's topic is going to be based on research, so I'll focus on what the literature says, which is one of the first and the most basic arm of evidence-based medicine. The research may, and as we are talking about a research question, the research may anything be, both, it all starts with a question. So it can be a simple question or a complex question. Questions like, let's just take ophthalmology of like what we are doing. Can smoking cause age-related macular degeneration? One of the most hot topic is, can eye rubbing lead to progression of keratoconus? It was a question few years back, but now I think almost the entire world has started believing that yes, eye rubbing can lead to somewhere it is related to progression of keratoconus, and if we stop eye rubbing, we can halt the disease, or we can arrest the progression, or at least prevent the progression. And the third question everyone knows is, are thin corneas at higher risk factor for developing glaucoma? So everything is there, but how do we make sure that there is a reliability of our research-based evidence? Let's understand it step by step. Why is it important? Because whenever you're trying to do something step by step, or a brick by brick, or a drop by drop approach always helps. Whenever you're trying to climb a staircase, we cannot just climb from the first to last. You always have to take one step by other step. Whenever you're trying to build a building, you cannot just decide today that I want to build a building and tomorrow the building is ready. It has to be brick by brick, and if you do a good job building a brick by brick building, it's going to have a good stability and a good one. And of course, when you're trying to fill water in a in anywhere as well, it's drop by drop. It's never from first to last. It's always step by step. So that's the most important thing. And if you start like with a step or a drop, this is how you are today, or maybe even you do not have this much in your pocket. But if you get improved by 1% every day, 1 year later, this is what you are going to be. So everything looks difficult in the beginning, but if you change by 1% every day, this is what happens after a year. So everything is about patience here, and everything is about a stepwise approach. So what is a stepwise approach in forming a research question and a protocol? So today's my topic is going to be divided into purpose of a research question and a protocol, sections, pathway, types of research question, criteria to a good research question, and a little bit about how we go about it at our institute in our practice as well. So coming to the first part, let's take an example which a lot of you might be hearing today is diabetes. Like, you have diabetes, but is there a way without medications that medications can control diabetes, but can you reverse the diabetes? It's one of the questions where you can bridge a knowledge gap. And the second is the progression of keratoconus driven by inflammation? So that is also one of the topics which we have addressed in our clinic, in our hospital, and that is something bringing something new in the field which is scarcely approached. So these are like, this is how you start asking a question that can dietary inventions help reverse diabetes, or is the progression of keratoconus driven by inflammation, and if yes, how do you address the same? So whenever you want to do a research protocol or a research question, it all starts with, you have to think all the aspects of a study, like what's going to be the methodology of the study. You have to take care of the ethical considerations, because as doctors, when we are doing research, it's somewhere related to patients, and whenever there's a patient involved, we have to make sure that the ethical consideration is it's taken care of. And whenever you're doing research, if it's a basic research, some clinical data evaluation, it might not cost you much. But if you're trying to progress in your field of research, then somewhere you have to think about funding as well. And I'm very happy because I keep hearing that the WOS team and the Winr team now is collaborated with DBT. And last year, WOS team did get the 2 most prestigious grants, which were acquired by the women themselves. So it's nothing is difficult. It is all doable. It's just that you have to start somewhere. And you can start working as a single investigator when you're starting, but slowly, if you want to do something big, there is no harm in building a team, like how the red eye disease, the rare eye disease team is being built now, where you are trying to collaborate with different centers across India at this point of time to just collect data on the rare eye diseases, and trying to build a collaborative on doing what research lies. And it's just collaboration with other institutes, universities, nationally or internationally as well. So you can think about it. And when you are trying to do the same, what is the purpose of a research protocol? You need as I said, the ethical clearance is very important, because we are dealing with either human volunteers, or somewhere you might be dealing with animals as well. So we do require to adhere to the strict protocol, and that's why the assessment of the protocol is very important. And anytime you try to do a research, it has to go through an institutional or a standalone ethics committee. Approval is very important, because that makes sure that your research is ethical, approved by an ethics committee, and tomorrow you will have no questions asked by anyone that are you doing an ethical work. So just developing a research question is not enough. A research protocol is equally important, and once we have a research protocol, getting it cleared from the ethics committee is most important before you start doing your research. And of course, when you are dealing with everything, funding is important. So, or if you are applying for a grant, your protocol has to be strong enough, because it will be in a scrutiny by the funding organization, which predates the grant of funding. So that's why the protocol is a very important thing when you start research for the ethical purpose and the funding purpose as well. So coming to the next point, which is going to be sections of a research protocol. The sections of research protocol are you need to have a preliminary research question. Like you need to narrow down the topic through preliminary research, like how Dr. Nisha showed last week, that you can do a literature search on PubMed and you can narrow down that what area you want to work into, and try starting there as well. And the next come is working knowledge of the topic. Like you need to do something, you need to start something which is your area, and then broaden your horizons. And when you start doing research, uh, you there will always be knowledge gaps. There will always be something which is known, but not everything is known in a particular disease or a condition. So there will always be a knowledge gap, and you cannot. And when you are trying to write a research protocol, a research question, you cannot do something which is already published, something which is already known. You need to do something which is not published and something which is not known. So you have to identify that knowledge gap and then proceed further. And that's how you design a preliminary research question. You first narrow down your topic, you see what is missing, what is the knowledge gap, and based on these two things, you design a preliminary research question. And after thorough evaluation, this is how it is done. So what are the sections in a protocol? The sections in a protocol are, you need to have a project title, you need to have a project description, you need to have number of centers involved, details of principal investigator, and project summary. So project description can be why is the need of the research, the relevance of the study, bridging the knowledge gap and benefit to masses. Whether it will benefit, you are trying to bridge the knowledge gap, but whether it will benefit to the mass or not. And in project description, sorry, 1 minute. In project description, you need to have objectives. Objectives should be simple, specific, and stated in advance, and secondary objectives may also be mentioned. If the objectives are simple, specific, and advanced, and those will be the primary objectives, and if you have secondary objectives also, you can mention it, so that you can cover multiple points in one research protocol as well. And don't try to put too many objectives in a study which cannot be adequately achieved as per the protocol, because otherwise you'll have a problem in the ethics committee. So you need to have a primary and secondary objective, but simple, specific, and not too vague or not too this one. Then next thing, you need to have a methodology in which you need to have a research design, or what will be your study participants, observations. Are you going to have an interventional approach or not? What is going to be your sample size and data analysis? All this is going to be covered in the later part of it, but all these are part of research protocol. Whenever you write a research protocol, you have to mention all of this. So you'll be like, okay, I have not even started surgery. How will I calculate the sample size? There is a way of calculating a sample size prior to starting your research, and which is based on the literature search as well. That is how you calculate and put it in your research protocol as well. Otherwise, you cannot just say and go and say that I need to study 100 patients. No, if you're studying a rare condition, you might have just 5 patients, and that's your sample size. But if you're studying something on diabetes, you might have 1,000 patients. So sample size has to be based on literature search, and it has to be put in the methodology. Because tomorrow, if you have applied for a ethics committee clearance for 100 patients, but then you realize that you need 1,000 patients, you need to redo it. And redoing an ethics committee clearance is not always easy. There will be a lot of questions asked. So that's why it's very important in the beginning of how you go do step-by-step approach, and how you mention each of it very clearly. Some little bit modifications here and there are required, but otherwise this is the approach. And whenever you are applying for a research protocol, the entire idea of developing a research protocol is for your team and for the ethics committee. So you have to make sure that you do mention that the proposed research is going to be carried out in accordance with the World Medical Association declarance of Helsinki on the ethical principles for medical research. You need to read about this World Medical Association declarance of Helsinki, and you need to make sure that your research protocol in question do fall in this criteria. If not, then you cannot apply for a ethics committee clearance. And you also need to have a consent form where everything appropriate is mentioned, and it also has to be attached to the protocol, and it should be written in for example, you are in Delhi, Hindi or English. In Hindi might be the mother tongue, or if I'm in Karnataka, Kannada is the mother tongue. So whatever research protocol I'm writing and I'm making a consent form for the same, it should be written in a prospective subject's mother tongue. So that has to be taken care of. And you need to have literature search. I'm sure Dr. Nisha has covered this last time. You need to add the relevant references on your subject of the research as well. And how do you quote a reference? It's readily available on PubMed, but if not, this is the sequence of how you mention a relevant reference in the research protocol as well. Third comes the pathway to a research protocol. Now, what are the documents needed? You need a research protocol, as mentioned earlier. You need an informed consent form. You need a patient information sheet, information and curriculum vitae of CV of the researchers, data collection forms or the case report forms. If it's going to be done, and you need recruitment tools like pamphlets, posters, or other media. If you are going to do a social media marketing of recruitment of the patients, and if you're going, then it also has to be attached to your research protocol as well, because you need to take ethics committee approval that this is what we are going to do, and this is the posters or pamphlets we aim to use, and you need to take clearance for the same, that whether it's ethical or not. And now with the code of conduct, the medical code of conduct getting stricter and stricter by day, I think all this is very important to keep in mind when you are writing a research protocol. Now, what are the type of research questions? Type of research questions can be qualitative or quantitative. And we'll go step by step. Quantitative can be descriptive or comparative. Descriptive can be like, attempt to describe the behavior of a population in regard to one or more variables, or describe characteristics of those variables that will be measured. For example, we wanted to, like, there are new topographers in market, okay? Like every year or every few years, there is a new topographer coming in the market. And not always one patient will stick to one clinic. Patients might go from one clinic to another. How do we know whether this, and when the new research tool comes in our practice as well, like a topographer, how do we know if it is repeatable and agree, like, whether it's having an agreement with other topographers or hygrometers as well? That's when a descriptive research question comes into play. Whenever I want to study a repeatability and agreement of any topographer or any machine or any OCT tool, that comes under the descriptive question. But if I'm trying to compare two procedures, if I'm trying to compare like two types of cross-linkings, conventional versus accelerated cross-linking, or if I'm trying to study different types of cross-linking protocols in one study, that comes a comparative. Or if I'm trying to compare two IOLs, if I'm trying to compare two vitrectomy machines, a lot of these comparisons comes in a comparative quantitative research question, which is to discover differences between groups within the context of an outcome variable. And then comes the qualitative research, which can be contextual, descriptive, or evaluation based as well. So again, in Narayan Netralaya, there was the contextual is nothing but to attempt to identify and describe existing condition, like, ROP babies. Let's consider ROP babies. They need a screening tool. Not everyone can come to the hospital, and not every hospital has a facility where they can see a premature birth baby retina, which is very important because they are at high risk of developing ROP. So, the condition was already existing. The technology to identify that is, of course, existing. But we wanted to see whether, there can be any other modification to existing technology, like wide field imaging, or a phone camera, or a smartphone reporting app, something like that. So that comes in contextual qualitative research question. If you want to assess, generate the data that describes who, what, and where of the events or experiences, that comes under the descriptive type of research question. For example, we wanted to study whether the post-refractive surgery patients, there are a lot of, like all of us who do post-refractive surgery or cataract surgery, a lot of patients come back to us post-surgery who are unhappy. Now, there are a lot of conditions which are known in literature which makes the patient unhappy. but sometimes you do come across patients who are always unhappy and you do not know what is happening. So we wanted to identify that, whether the personality can lead to psychological manifestations of post refractive surgery unhappy patients. So how do we go about it? It comes under the descriptive qualitative research question. And there can be an evaluation also, if you want to evaluate an existing method, protocol, theory, or procedure, which a lot of research which we do in our clinics is based on evaluation. Like, you want to evaluate how the cross-linking procedure works. You want to evaluate how a keratoplasty procedure works. You want to evaluate how intravitreal injections are working. That type of a research question is known as a qualitative research question. And then the other two are explanatory and exploratory. If you want to examine a phenomena or analyze the reasons or relationships between subjects or phenomena, it comes under the explanatory. For example, post-PRK haze. Everyone knows about post-PRK haze, but we knew how to manage the post-PRK haze as well, but we never knew an algorithmic approach to it. So we wanted to develop an algorithmic approach and see whether it's working or not. So that comes under the explanatory qualitative research, that we are trying to explain a situation and trying to give an explanation to a condition and whether it's working or not. And exploratory is nothing but focus on the unknown aspects of a particular topic. Very, very again, the psychological aspect in patients, ophthalmic patients attending the tertiary eye care center, that will come under the exploratory thing, that there is something happening, but we do not know whether it's an unknown aspect of it. So that will come under the exploratory condition. So these are the types of research questions. Now, what will be a criteria to a good research question? Whenever you're trying to write a good research question, it's a very known condition which is known as the Picot framework, which is the popular. First, you need to identify where you are trying to do the research, your population, patients, or the problem. Then whether it's an intervention or indicator being studied, whether you are trying to compare the situation or compare the condition or not, what is going to be a tentative outcome of the interest, and the time frame of the study. The time frame of the study is again very important. Today I write a research question, a research protocol, and apply to the ethics committee. But if I do not start and okay, it will happen, it cannot happen. You need, whenever you start a study, you need to have a tentative time frame to the study, and then only it will work. Otherwise it will never work. And the other aspect of it is like the PO framework. It can be again the same thing, but a different framework, a PO, population being studied, or exposure to pre-existing conditions, or the outcome of interest. And how do you know if a research question, if you have a good research question or not? The good research question has to be feasible, it has to be interesting, it has to be novel, ethical, and relevant. So it is just nothing but the finer criteria. And if you have taken care of all these 5 aspects, then you know that you have written a good research question. So it does sound quite exhaustive, but and when you are doing a research, it's just like your curve, which you can see here. When you're walking, the path is straight. But when things start becoming difficult, when you start climbing up, there will be a point of time when you start climbing up, you'll feel that, should I give up because this is not working? I think that's the time that, you should just keep walking, even though the path seems difficult, because if you don't give up and if you keep walking, it's just that moment which changes it all. And next part, I will just give some examples where we thought of giving up, but we, pushed by our mentors, pushed by our teachers and other forces, didn't let us give up. And that moment changed a lot of things, what you see today. So just two examples, like asking why, how does forming a research protocol, a research question help? My mentor, Dr. Rohit Shetty's PhD and my PhD, just 2 examples. Does inflammation play a role in pathogenesis of keratoconus, or which refractive surgery is better? Is it SMILE, LASIK, PRK? These were the 2 simple questions we started with. And when we started, we formed this research questions. Those were broad research questions, but we started collecting the data in a very formative way, like clinical examination, the clinical investigations, vision, refraction, post-surgery visual outcomes. Then we collected imaging data as well, like whatever imaging data was relevant to keratoconus or refractive surgery. We collected all of this data in an appropriate way. We formed a research question, we formed a protocol, we formed a format of what we want to do for these patients. We did not know, we just wanted to answer, is inflammation a role or is which refractive surgery is better? And we just started doing a step-by-step approach. We just started collecting, and apart from the imaging data, we collaborated with our lab, Row Lab also, and where we collected for keratoconus, blood, stroma, epithelium, tears, for molecular analysis, for gene expression analysis, for inflammatory molecular analysis. And the same arm, when the patients were undergoing refractive surgery, there as well, the tears, epithelium, or lenticule intraoperatively were collected for lab analysis. And just collecting good data while doing research, will not go into detail, but it gave, just from these two questions, we were able to have at least 75 publication and 3 PhDs from these two questions. So if you form the research question in the right way, if you collect the data in the right way, and if you write your protocol in the right way, this is how it helps. It does not help you in answering a question, but it helps you in publishing your work. And maybe if it's a good topic, or if you are interested in it, it can also help you in actually doing a PhD. And Winr is nothing but just about women in research. And somewhere you all would want to be here at a phase where there has been. Does the research stop there? Answer is no. You might all think, okay, everything is lab based, but how are we going to bring this into clinic? With these three PhDs, we did answer that inflammation does play a role in pathogenesis of KC, and there is no difference in both the surgeries, be it LASIK or SMILE. And whatever safety criteria you're following for LASIK and SMILE, you should follow here as well. But how do we take it further? Because all this was, the tears and all were collected and taken to the lab and analyzed. Let's take care. What we did was, are there any specific inflammatory markers relevant? We proceeded further and we built a point of care diagnostic kit, where we can just take the tears in the clinic and we can analyze all these biomarkers just in the clinic in 90 minutes. So while your patients are undergoing scans and examination, you can actually do a tear test and find out which of these biomarkers are abnormal, and you can have the answer in your clinic, and you do not need to go in the lab. Same thing for refractive surgery or collagen imaging, which was the main part of my PhD. How do we take it forward? Our team, along with collaboration with University of Vienna, built a polarization sensitive OCT, where you do not need to take stroma like from the eyes of the patient. You do not need to take it, put it in the lab and do a gene expression analysis. Now, just with an imaging modality, you can study how the collagen of the eye is, just like with an OCT, whether it's normal or unhealthy, and then you can decide the surgery. So research is definitely a stepwise approach, and it can be done. I'll just give you one more simple example, like post-PRK pain management. There were BCLs, oral medications, and a lot of topical medications as well, but the pain was never coming down. And that's why people stopped doing PRK. PRK, instead of doing one of the best surgeries as well, people did stop doing PRK. So once our mentor, he brought a thought of, why don't we soak our bandage contact lens? Anyways, we are placing a bandage contact lens on the patient's eye. Why don't we soak it in a ketorolac solution, a preservative-free, a suspension-free solution? A lot of our fingers were raised against us for delayed epithelium healing or corneal melt. But the point here was, we used a preservative-free and a suspension-free molecule. And just from using this, our pain scores came from 8 to 10 to 4 to 6. So this was a very simple approach which helped us reducing the pain, and it helped us in increasing patient satisfaction when they undergo PRK, and gave a lot more confidence to us when we are doing PRK. So it did reduce the scores, and we happily used it for 2 years. And then we were like, fine. But then we started thinking that, can we bring down this pain even further? So what we did was, we just didn't know anything. This bandage contact lens is what we were using with a room temperature. We just started keeping it in refrigerator overnight at 4 degrees Celsius, and which is known as the cold BCL. And in the cold BCL, we just started using it. And what we saw was that the pain scores further came down. Like conventional, it was 8. Then I said it came down to 5 with ketorolac soaked BCL. But when we started using a cold bandage contact lens, our scores came down to an average of 2, which is hardly anything. So we just discovered a significant impact of cold temperature on post-operative pain along with with or without ketorolac as well. And then we did the molecular analysis of the same as well. And it was seen that yes, the cold BCL does modify your thermoreceptors in the eye, and that's how it controls the pain. So of course, when you start, it looks like it looks like an impossible journey. But when you take baby steps, as mentioned before, it starts becoming an easy. And after a while, you become a pro at it. And then it just becomes like, how you juggle the balls, like what you see in a theater. So that is how, the research has to be done. And that is how, you have to have a step-by-step approach. And the journey just doesn't stop at the first question. You always have a way that you can keep proceeding further. So what next? You have to stay updated on the current trends, state-of-art research, and technological advances in your field. You have to refine idea at all stages, incorporate them in your research questions and research protocol, and make the research question as specific and concise as possible to ensure clarity. And besides literature, seek the input. Like the most important part is literature search. Forming a research question, research protocol is very, very, very easy. Okay, to be very honest, first two will sound difficult, but it becomes easy as you move on. But always try to seek input of experts, mentors, and colleagues when you're writing your research question and protocol. So it did seem difficult. This was like, which one was while trying to answer what was better, LASIK or SMILE, we did come across various rejections. These are all the papers of my PhDs. And we had on an average, only for 8 papers, we had 41 rejections, which was average of 6.8 times rejections. So it we all thought of giving up, but then it's just like this. Let's go. In between, it will look useless. Let's give up. But if you don't give up and keep going, one day you'll build a good building to go on. And that's how you can do it. So failing twice doesn't make you a failure, but there will be a lot of other successes. So even when you write a research question, write a protocol, conduct a study, if you feel you're failing and it's not working, don't give up, keep walking. I'm sure you'll find a way somewhere where, some tunnel will open up and you will have a success. The wise man doesn't give the answers, he poses the right question. So everything starts with the right question. And everybody wants to be successful. We know about it. A lot of you might have seen this picture, but it takes a lot of it before you see the success. So be patient and do well. Thank you.
Thank you so much, Dr. Pooja, for such an elaborate talk. And the topic was very thoroughly covered. I hope it already answered many of the queries which our applicants had. So before I take on the question, we have on board Dr. Purvasha Narang. I would like to welcome Dr. Purvasha, ma'am. She has finished her cornea and anterior segment fellowship from L.V. Prasad Eye Institute, and she's currently working as an associate professor in AIIMS Nagpur. Dr. Purvasha, are you here?
Yeah, hi. Good morning, everyone.
Morning, ma'am. So we have your questions. I think we should start taking. So the first question is by Dr. Gitanjali Bose. What are the chances of getting an article published once it is taken up for a peer review?
I just answered that question that, when you start first, you might have various, it's just on, there's a very important topic of choosing the right journal as well. So when you have a topic and when you're trying to publish, depending on the journal you have chosen, sometimes it might get published in the first time, but sometimes it takes 8 rejections as well to publish a paper. So rejections will be there, but try to be as concise as possible. try to find the right journal on what you're trying to publish, then the chances of getting it accepted at a very early stage becomes very good. For example, if I want to publish on refractive surgery, there are two journals, Journals of Refractive Surgery and Journal of Cataract and Refractive Surgery. A simple clinical work on refractive surgery will easily get published in these two journals if it's ethical and if it's done in a nice way. But if I try to publish an exotic molecular work, even if it's related to refractive surgery journal, but if it's an exotic imaging and molecular work, sorry to use these words, but yeah, that's true, then probably those are not my journals. I'll have to target for a journal which is publishing a lot of molecular or imaging based work, which is quite dense. So it all depends on how you choose your journal and how well those journal accepts it. So what you have to do is you have to go back to the journal and see what are the kind of articles being published and then see if it will fit there or not. But yes, you can have rejections up till 10 to 15 times as well. I know a professor, he wanted to publish a paper in NEGM and nowhere else. But he wanted to make a paper very strong and he did not know how to do it. So he kept, submitting in various journals. He had 51 rejections and he knew that he's going to have it. And then he got it published in NEGM.
Wow.
So 51 also is a number. Don't get disheartened by it. If you know you've done a good job, don't get disheartened.
And just to add, Pooja, that was a wonderful presentation, very elaborate and comprehensive. And yes, the articles do get rejected. And yes, at the beginning, it hurts a lot. It's a cause of pain and depression in the beginning. But if we take it constructively, the reviewers' comments are from a very different perspective and a different point of view they provide. So if you modify your protocol or whatever the research methodology or whatever suggestions that they have made, it actually leads to a stronger publication. So it is important to take those comments also constructively and not take it in a very negative sense. So that makes your research stronger.
Thank you, ma'am. So we have second question. I think Dr. Purvasha, would you like to answer this? The question is, it is by Dr. Alpa Atul, refractive cataract and cornea specialist. I find it very difficult to decide what should be my research topic. So how to go about it?
Yes. So yeah, Pooja, you would like to say something?
Please answer, ma'am. Please answer.
So deciding a research topic is basically the first thing that you have to understand is you want to do research. So you should be clear in your mind that you have to go ahead with this. And then that topic which is closest to your heart should resonate with the research that you want to go ahead with. So if you are working and you feel strongly about a particular topic, I think that is where you should put in your ideas. And this first part of framing the research question, I think, is the most important out of the entire process. Getting your research question right is the most important part, where your vague ideas and everything are now distilled down to that one particular question, which will take you forward. So if that question that you're framing is close to your heart and you want to give in your time and energy and resources to it, I think that becomes your major research question, which you should start. In the beginning, I would suggest it should be simple, it should be doable, and as Pooja has pointed out, the FINER, the FINER, show how the criteria should be very well researched. And this criterion should be looked at. F for feasibility, whether the feasibility of doing that research is there in your part of the setup. I for, I think, interest. I think interest is both on the part of the reader as well as your interest, whether you want to take it to the entire end, till the entire end and complete your research. And then I think N is novelty, whether it's already been done. If PubMed and search engines are full of the research, I don't think it's worth going again and again in the same direction and reinventing the wheel. And E is for ethics. Ethics is most important these days. You have to have an ethical approval, otherwise you can't continue with it. And R is for relevance, like what happens after you finished your research? How does it translate into something else, or does it actually make a difference? So this finer criterion, if it fits into your research and that idea that you have, and while framing the research question, I think that will take you forward and that will help you decide. So in the beginning, you might put this to one or two ideas that you have and see which one is more appealing to you, and that should be pursued.
Thank you, ma'am. So I had one question last week. There's this Konya fellow. She didn't name herself. She has recently joined as a Konya fellow, and she's asked to do a thesis on specular microscopy or interior segment OCT. So she wanted some guidance on how to choose a topic and what to choose as a research topic.
Yes, so one of the ways to go forward is choose a machine for first, and then look up into the literature as to what kind of research has been happening of late, and also the type of patients that are attending your clinic. That is important. So if you are into transplants, or if you're into endothelial keratoplasty, then you have to go into that side and try and frame your research question based on the number of patients or the type of patients that are attending. So getting your resources right in the initial part is important. So if you don't have many keratoconus patients attending your clinic and you plan a research there, then your sample size will not be reached. So I think feasibility and relevance to your particular setup is important. So if between ASOCT and specular you can find a topic which is common to both, also would be feasible, but you should have patience for that.
Yes, ma'am. I heard the applicant, Dr. Alekhya is listening. Otherwise, I'll talk to her. So our next question is, why is research important when end results are usually obvious in most of the studies done?
I don't think that is that way, that the end results are always known. So it's never the way. If end results are known, why would you do the research? Which obvious a question. Research is always done to identify something, or to study something which is not known. For example, when we started doing refractive surgery research of which is better, or keratoconus research on is inflammation driving keratoconus, it was not known. Still, if you go and see back, the definition of keratoconus at some places still mentions non-inflammatory. But now the world does know that it's become inflammatory, and we have started treating it the same way. So if you know the end results, that means your research question is probably not right, and you're trying to study something which is already known. Research question and protocols are always for something which is unknown, or something, the knowledge gap basically.
Yes, okay, ma'am. So we have a question from Dr. Tanuja. She's asking, how does a standalone neuro-ophthalmologist go about with the research? Do I have to go to the ethics committee before I come to my clinical results? If I'm just extrapolating the data I get from my patients, however small or big it is, I always take my patient's consent, even if it is not for future reference.
So if you want to publish your work, or if you want to translate your work, then yes, you do need an ethics committee approval. If you're just trying to identify for yourself or study for yourself to improvise your practice and not trying to publish anywhere, then it's okay. But wherever you want to publish, or even if you want to present your data, okay, for example, you're studying a papilloedema case series or something. Tomorrow, if you want to present it somewhere, you need not a talk, but a paper in a conference, or a poster in a conference. Those times you do need an ethics committee approval. But if you're just doing it for yourself, no. And yes, a standalone practitioner cannot have access to an ethics committee. And now I think WOS is giving an opportunity to the women members that you can, through WOS has an ethics committee through which you can apply and get a clearance. So they're making it easy for you.
Yes. So I hope it answered.
Ma'am can add something if she like, if you.
Yeah, I should not hear. I actually have a topic. We have a talk on ethics committee, so I think that will clear the point more. So our next question is from Dr. Devapriya. If a new surgery or procedure has already been carried out in some other country and I'm trying to replicate it, do I still need ethics committee clearance?
Yes, I think it has to be done, because for that particular set of rules and regulations have to be followed, and country has its own set. So I think the regional or the local ethics committee approval is mandatory.
Yeah, yes, ma'am. Okay, so for as of now, we don't have any other questions. So I request applicants to please write the questions in the chat box of the Zoom link or in the WOS group. I think you can wait for some time and so we have one more question. How to select the keywords for my manuscript?
So keywords have to be based on your research question or what you're trying to study. For example, if you are trying to study pain management after photorefractive keratectomy using a cold bandage contact lens, then your keywords can be PRK, cold, BCL, pain management, something like that. So your keyword has to be a 1 word or a 2 word and very short, relevant to your manuscript or your research question. And very specific words, like, your keyword should tell what you're trying to address there.
Yeah, so I keep on getting these questions because writing, we don't have usually, I think, word limit in research protocols, but applicants have problem in writing an abstract, writing a running title where they have to be very concise. It should be representative of the whole protocol. So can you put some light on how to write a running title, how to write an abstract?
So running titles should be like a very short form, like just pick 3 or 4 words from your main title. For example, we are trying to study the next generation UVA calculator for modified fluence, which is used in thin corneas. If I want to do a running title, I will just do cross-linking for thin corneas. So I will just pick up the main points from my main title and put it in a running title, because that is just 5 words, probably 5 words in that you have to finish. If I'm trying to study biomechanics of LASIK flap and smile cap, a prospective case series, then I will probably, just write biomechanics in LASIK and smile. Something very simple. It can be similar words like your main title, but it's still doable.
Okay, thank you so much, ma'am. There's some technical glitch in my video, so pardon me for that. So I think we don't have any other questions. We can call it a day. I would like to invite Dr. Purvasha to address the applicants and have a few words.
Just a few more words on the keyword thing. I think you should always go through your entire manuscript and select the words which are recurring. So if it's about a technique, or if it's about the surgery, or it's about the machine that you want to speak, I think those words have to be included. They are the major ones that need to be included, even short forms. And these are the words with which all the search engines and your Google algorithms will be searching your article. So if you want your article to come up in searches later on, I think you have to highlight whatever keywords are there in your entire manuscript. So that is important, and these words help bring your research to the forefront. So it's very important to choose the keywords properly and appropriately. And I think Pooja has otherwise covered it very well. And research question is very important at the beginning itself. It makes your abstract. So always, even formulated a research question, it's nice, or it's important that you also circulate it amongst your peers and see what what kind of inputs they are giving you, and that peacock the
Hello.
Dr. Purvarsha, are you there?
Hi, am I audible? Am I audible? Not sure.
Dr. Purvarsha, you are not audible. I think there is some network problem.
Nisha, am I audible?
Yeah, now it is streaming there. Yes. Hello. Ma'am, you are there?
Hello. Hello.
Hello, ma'am. I'll just talk to Dr. Purvarsha and ask if there any connection problem. We have one more question. Am I audible?
Yes. Yes.
Yeah. So it's from Hyderabad that how do we import references into the citation managers like EndNote and Zotero? Sorry, not Zotero. EndNote and RefNote.
Hello.
Hello.
Yeah, I think I'll answer that question.
Yeah.
So it's a very simple way. I think last time when you covered literature search, I'm not sure, but when you are on PubMed, it gives you references. in different formats, LMI, NLMI, and other formats, and Vancouver format. So you have to see for what journal you're trying to write a paper. And for example, I'm trying to write a paper for X type of journal, and they want Vancouver journal. I go to the EndNote, I select that what type of referencing I want, and I activate the referencing there, and then I start putting the references. So what happens is, for example, if I put reference number 1 in my manuscript and the same thing I put downstairs, it will automatically get encrypted, and then I just have to put number, and it's an automatic numbering. But if I delete any reference from the manuscript, it gets deleted from the main referencing details as well. So it's just an activation in the EndNote, what you have to do, and you can just start entering wherever you want.
Okay.
But that will be covered in detail by How to Write a Paper by Dr. Santosh and Dr. Chaitra, I think.
Yeah. Okay. Thank you so much, ma'am. We don't have any other questions. I think we can call it a day. Thank you so much, Dr. Pooja, for taking out time and agreeing to give a talk in this course. It was a very nice talk, it was very nicely covered. And thank you so much.
Thank you,
And
Nisha.
thank you for all the applicants for joining us.